Very good morning, dear friends. Today we are going to discuss about the third session of congestive cardiac failure, in which we are going to discuss about the others positive inotropic drugs. It includes number one, phosphodiestrase inhibitors and piperidine derivatives like ambrinon and milrinone. These drugs inhibit the enzyme phosphodiestrase type 3, which generates cyclic AMP, resulting in rise in cyclic AMP level. It increases force of contraction and also causes vasodilatation. Route of administration: this agent is administered intravenously. Any adverse effect that includes number one, a dose-related thrombocytopenia, it may occur, and ambrinon may increases the ventricular rate in patient with atrial flutter or fibrillation. Now, because of the adverse effect and increased mortality seen with the use of these drugs, they are not preferred now. They are reserved for the short-term therapy of congestive heart failure that is refractory to other agents. Other drugs used in congestive cardiac failures. In congestive cardiac failure, the heart is unable to provide adequate blood supply to meet the demand. The aim of the treatment is to reduce morbidity and mortality by restoring cardiac output and relieving congestion. Drugs commonly used in the congestive cardiac failure or chronic heart failure. Number one, loop diuretic, that is furosemide. SE inhibitor, that includes captopril and enalapril. Digoxin, especially for heart failure associated with established rapid atrial fibrillation. It is also indicated in patients who remain symptomatic despite treatment with loop diuretic and SE inhibitors. Other vasodilators, organic nitrates, for example, isosorbide mononitrate, reduce preload, and hydralazine reduces afterload used in combination. This prolong life but less effective than SE inhibitors. They are used when SE inhibitors are contraindicated or not tolerated or not available at all. Now, diuretic therapy and sodium restriction. It also play a very significant or important role in reducing extracellular fluid volume. Diuretics relieve symptoms of heart failure more rapidly than any other oral agent. And along with digoxin, they are the first line drugs in the treatment of congestive heart failure. Alpha-adrenergic blocking agents that includes or may be used in congestive heart failure to improve cardiac function by inducing vasodilatation through both direct and reflex action. And number three, angiotensin converting enzyme inhibitor, ACE inhibitors. Now, how does they act? So, ACE inhibitors, they include captopril, enalapril, lisinopril, produces beneficial hemodynamic effect by decreasing the conversion of angiotensin 1 to angiotensin 2. They also inhibit the degradation of bradykinin. Hemodynamically, these agents increases cardiac output by reducing afterload and by decreasing total peripheral resistance, pulmonary resistance and preload. All these are decreased. Now, reduction of afterload. Angiotensin 2 is a powerful vasoconstrictor present in the plasma in the higher concentration in the cardiac failure. ACE inhibitor reduces angiotensin 2 and that's why it causes vasodilatation. Reduction of preload. Aldosterone causes salt and water retention and increases plasma volume. ACE inhibitor inhibits or reduces this effect. Now, reversing compensatory changes. Angiotensin 2 formed locally in the myocardium is basically responsible for the various undesirable compensatory changes like ventricular hypertrophy and ventricular remodularization seen in the congestive cardiac failure. ACE inhibitors reverse this change. Therefore, ACE inhibitors are the most preferred drug in congestive heart failure. You see here, angiotensinogen from the renin kidney, it converted to angiotensin 1. ACE inhibitors convert angiotensin 1 to angiotensin 2, so it reduced and decrease. It leads to decrease in the sympathetic output, increase vasodilatation, decrease in aldosterone production, increase in the bradykinin, decrease in the sodium and water retention because of the reduced production of angiotensin 2, as this ACE inhibitor block the conversion of angiotensin 1 into angiotensin 2. So overall, ultimately, there occurs reduction in the preload and afterload, and there occurs increase in the cardiac output. Therapeutic uses or the indications. Today, ACE inhibitors are used as first-line agents for congestive heart failure. Adding an ACE inhibitors to therapy with diuretics and digitalis has increased the survival rate among patients with mild to severe congestive heart failure. After myocardial infarction, ACE inhibitors may lessen the progressive enlargement of the left ventricle, so it inhibits remodeling, you can say. Adverse effect: severe persistent cough occasionally may develop or may occur. Hypotension and deterioration of the renal function can occur with ACE inhibitors or diuretic combination. Hypokalemia and ventricular arrhythmia occurs in congestive heart failure patient given an ACE inhibitor combined with diuretics, and adverse effect associated with captopril such as rashes, taste disturbances, proteinuria, leukopenia may be related to the sulfhydryl moiety of the captopril. Other vasodilators. Other vasodilators may be used for the patients not responding to digitalis glycosides and diuretics. Arteriolar dilators decreases afterload, whereas venous vasodilators reduce preload. The decrease in preload and afterload increases cardiac output while reducing pulmonary congestion. Isosorbide dinitrate, hydralazine, and prazosin, all these have been used in the treatment of congestive heart failure. Isosorbide improves cardiac function, but it has not been shown to improve survival rates when used alone. Increased survival rates with which has been demonstrated with isosorbide and hydralazine when used together. Beta blocker, metoprolol, and bisoprolol. The immediate hemodynamic action of beta blocker is to depress cardiac contractility, and on this presumption, it was not used in the past for the treatment of congestive heart failure, or even it was contraindicated. But extensive studies over past 20 years have been established that this you can say parameters, cardiac depression and incontractility due to beta blockers gradually improves over a week, and after few months ejection fraction is generally higher than the baseline. So they are now contraindicated only in patients with marked fluid retention, otherwise they can also be used. So this completes congestive cardiac failure. Thank you very much.